Play. Oh, we're live. Hi, everybody. Joe Moore here with Psychedelics Today, joined by Dr. Lipov and Lara. Lara, I never actually asked you how to pronounce your name, and I'm sorry. What's your last name?
Tambacopoulou.
All right. Well, thank you for being here. I'm very excited to have you both on. And Dr. Lipov, we're kind of, I think, primarily interested in talking about your work. And we're going to dig into some really interesting stuff today around trauma resolution, as it says in your footer here, easing PTSD now, which I assume is a 501 that people can donate to.
I was trying to write erase. I'm so sorry. I need to change
Erase PTSD now.
Erase. That's the name of our non-for-profit. I'm very sorry. I'm obviously dyslexic. So it's Erase PTSD now. If people want to donate, that's great. It goes to help people in research. Anyway, I'm happy to just kind of give you a blurb, or you tell me what to do, sir. I always follow directions.
Yeah, let's have you start. Just high level. What is it that you have been doing lately? It sounds like an extraordinary intervention.
You're very nice. So let me give you my background. You'll see what, why, and how. So I was born in Ukraine to a vet from World War II. So 10,000 people in his squadron, 100 made it home. He was a complete mess after that type of experience. So he gave that his PTSD, and we'll talk about the term PTSD eventually, that the need to change of that. But anyway, he gave it to my mother. It's called secondary PTSD, who took her life eventually. So I was a surgical intern at that time. So they gave me a lot of interest in preventing it in other people. So going really fast forward, I was doing pain medicine, and there is a procedure called stellate ganglion block. It's an injection in the neck that's been used since 1925 for pain conditions like burning hand, nerve pain, things like that. So I figured out that it worked for hot flushes. So there's a publication about it in Chicago Tribune, and they basically called me a radical scientist because I didn't know why it worked. So I read about 3,000 articles. One of them was from Finland, where they were doing clipping in the chest to take away hand sweats, and they found PTSD went away. I was like, why would that be? So I dug into a little more. Then I found that the nerves from the chest go to the neck and to the brain. And that's led me to an idea to do an injection that I know how to do for hot flushes, for pain, to a PTSD. The first publication came out 2008, and it's been replicated in Walter Reed, Fort Bragg. About 10 to 15,000 special forces guys have been treated this approach. So let me just tell you the physiology. So I consider myself a psychophysiologist. I like to understand the biology, right? So people talk about PTSD being an invisible wound, for example. You probably heard that term. So to me, when you say that, it means you have the wrong scanner. Like if you don't have an X-ray and the leg hurts, you take an X-ray, you can see the broken leg. So if somebody says, I can't sleep, I have sexual dysfunction, I'm always angry, all of that, and you do a brain scan using functional MRI, PET scan, or MEG scan, those three advanced scanners, you can actually see the amygdala, part of the brain that controls anxiety, light up. So when people say it's invisible, that's not true. You just don't know literature. So here's what happens. When somebody is experiencing trauma, military trauma, sexual abuse, whatever, being bullied, does not matter. So the fight and flight system gets overactivated because the amygdala, which is the main controller of that, tells it's like bad things are happening. And if it happens, great. Like you almost got hit by a bus, you hyperventilate, but then you calm yourself down and everything's fine. But if it's severe enough, like military trauma, rape, something horrible happens, natural disaster, continuous bullying, any of that makes the brain grow new nerve fibers called sprouting. Like, so fight and flight nerves, let's say they're usually 4, now you got 8. Each one of those produces norepinephrine. As long as norepinephrine is increased in the brain, people will have symptoms of PTSD. And I use German in quotes. So turns out when you do local anesthetic injection in the neck, 2 things happen. Number 1, norepinephrine drops like a stone in 5-10 minutes. So people can feel markedly better in 5-10 minutes. But it does, number two, it changes a substance that's produced in the brain called NGF, and then go from the brain to here. That leads to the sprouting thing. It leads to pruning, takes away the extra nerves. So a block that lasts 8 hours can give you relief. Currently, the longest outlier is 17 years, 1-7, after a single procedure. So you can have a prolonged relief. So my particular, hopefully, claim to fame is to have figuring out the biology, and we were able to get people to publish on that, like Fort Bragg, home of Green Beret, as well as Lenchheim, which is in Germany, as well as Tripler Hospital, which is in Hawaii, did a combined study and published that in 2019, verifying that that's true. An amazing family foundation, Linda and Glenn Greenberg, gave us money to be able to do a big study that should have been done. I've begged VA to do that study for like 10 years. Basically, you want to do functional MRI before, do the block, and do functional MRI after, because then you can see the amygdala deactivation. And it seems that this is what's the study is going to show. It's not out yet, so I can't really talk about it. Frankly, I don't know, but it looks very promising. It should be out in the middle of this year. And I think there will be a significant change of perception, because the whole concept of thinking of psychiatric condition as this fluffy, non-specific, we really don't understand what it is ending. One way or another, it's going to end. So my last thing that I'm going to throw out there is I run into a man called Frank Ogberg, very famous psychiatrist. He came up with the term Stockholm Syndrome. So he was part of the committee in 1980. We came up with the term PTSD, post-traumatic stress disorder. So he believes it needs to be changed to PTSI, post-traumatic stress injury, because it's biologic, because PTSD is stigmatizing. I did the study I published in 2023 and 3,000 people, and I asked them, if you change the name PTSD to PTSI, what will happen? A couple of things. One, stigma will get better. Two, hope will improve. So nobody that has hope kills themselves. So if you're hopeful, you're probably not going to try to kill yourself. Three, they're going to seek more care. So I went to the American Psychiatric Association. So Frank now is not doing it anymore. He's 87, so he's kind of done with that. Anyway, and they told me, no, we have no interest in changing it. You don't have enough data. So what I'm doing right now is trying to do the bigger survey, 100,000 people, hopefully, maybe 1 million. So if your viewers can go on the website, itsptsi.com, it's ptsi.com, and just do a survey. It takes 2-3 minutes, costs nothing. But what I'm trying to do is get all of that together and then go back to the APA, because the point is not changing the name is causing harm. The whole concept behind American Psychiatric Association, the name change, which they have changed names in the past, is that if you can demonstrate it's causing harm, we will change the name. Well, it is causing harm. And it's not just me saying it, but who am I, right? I'm just an anesthesiologist. But a very famous psychiatrist said that. A 4-star general, Peter Chiarelli, joined Frank in 2013. He was in charge of suicide prevention for the Army. He knows a little bit about suicides. And they both had changed the name. The guys that I treat go change the name. Unfortunately, APA has been pretty resistant. So any help in that direction would be amazingly helpful. So the last thing to think about is when somebody talks about injury, it's what happens to you. Disorder is what's wrong with you. You're blaming somebody for whatever. But who's blaming you? If you fell off a roof or broke your leg, who are you blaming? Well, whatever, you fell off the roof. Identify it, fix it, move on. Oh, so sad. We have a broken leg disorder. Oh, sad. But crawl around the rest of your life like that. No, it's not. The point, my point is, mental conditions, whatever that is not a lifestyle. You can actually diagnose, you can treat. We're in 2026. We should be able to do better than we did a century ago, but we're doing the same thing, only less leeches. Go ahead. That's my speech so far.
Well, Thank you so much for that. And I concur with you.
Thank
I've
you.
been a yeah, what do I call myself? Amateur, unlicensed internet psychiatrist. And I
Wow.
we're like critic. Largely speaking, I'm a fan and critic of psychiatry. But it's like,
Me
we
too.
have to actually step in and start making these kind of suggestions. Do we actually want to perpetuate more harm? I think the answer is no.
Well, the other thing is,
Mhm.
people ask me, it's like, why? Like I've had this conversation yesterday. Why has stellate ganglion block not taking its place? Because it works very fast, has high effect, and it doesn't grow any tails. We know the complication rate. We know all of that. Why is it that happen? And then it's very simple. Follow the money, right? How much money is being spent? So each patient for psychiatrists, and probably will get some hate mail from psychiatrists, but whatever. It's an annuity. Each patient's annuity. You stuck with that forever. My idea, I used to be a trauma surgeon. You fix the injury, move on to the next guy. We don't have time of decades of making people sicker. And for example, atypical antipsychotics, one of the most common used drugs in the VA right now. If you use that irregularly, which everybody does, it increases the rate of suicide by a factor of 3. It causes diabetes. It makes the heart stop beating. 1 out of 1,000 per year use. So 3 years, so 3 out of 1,000 young men, the heart stops. It causes diabetes. It makes people angry. It makes them impotent. Besides, it's a great drug. Right? I mean, it's like, what are we doing? Move on, something more effective, like psychedelics, like TMS, like ketamine, like stellate. We already tried that for a century. And the other statistic that's really spooky to me is that this is the highest rate of suicides currently in the United States since World War II, 1941. Preteens are taking their life as the highest rate ever. We're talking about 9 to 12 years old. It's the 8th common cause for death. Preteens. Think about it. What were you doing with a preteen? Oh, okay, I have a truck. Yay, woohoo. We're not talking about trying to jump out of the windows or whichever they kill themselves. I mean, that is just mind-blowing. So whatever you're doing, let's change direction. The boat is going the wrong direction. Change the boat. Move somewhere else. Get a new captain. Something.
I like the concept of annuity. Laura, can
It's
you
true,
kind
though.
of talk about how this
Well,
came up for you?
for sure. Well, I've been into this psychedelic world for forever. It's been in my family through my mother and all that. And so I really believed in psychedelic and still do. And for the first few years, where I started working with people in preparation and integration and in retreats, there were certain people that were not getting better, or even worse. And, they had very similar symptoms, easily startled, no sleep. There were things that weren't getting better, And so the first time I became aware of Dr. Lipov's work was when I used to live in Vancouver. Must have been mid to 2015. And somebody told me this is the only treatment for trauma and all that. But, like everyone else who hears that, I thought, this can't be true. It's too good to be true. But I read about it. I followed his research and I thought, if only this could be true. It's just impossible. But yet, every year or so, I used to go back to the literature, what's been written, what are people saying. It wasn't easy for me to pick up the phone and say, okay, I want to try this. This sounds incredible. Because I thought it's one of those things. Because like everyone else, there's also this narrative in me that, trauma recovery is a long, arduous process.
Right.
I thought, like most
A
people,
lifestyle.
I have to suffer a little bit more to get out of this, or my clients have to suffer some more. They need to have some more visuals. They have to have some more battery. I don't know. So, so I was seeing people really struggling and all that, and being given the best care and the best retreats and the best psychotherapy and all these recurring things. And a lot of them were physical, truly physical things. And the one thing I want to say here is that, in the last 20 years, when we have really focused on mental health, there's been a lot of talk about the mind-body connection, which is, a way for us to wake up to the fact that, the mind and the body are not two separate things. And we have to see them as one, and this holistic approach. But in the process of doing that, I think we've forgotten about the body, that biologically, we have to listen to what's happening, because we can, do a whole lot of psychological things, but if the body is not well, we ain't going anywhere. The body needs to feel healthy in order to be mentally healthy. So anyway, cut the very long story short. It is a long story because I think I've known about Dr. Lipov for about 10 years. Last fall, I searched the internet and I wrote to him and I said, I want to talk to you. And this is how I am. I have to go to the top. I don't really settle for less. So I thought, I got to talk to this guy. It took about a few hours. He sent me an email. He says, what's your WhatsApp? Anyway, we got on the phone, talked for about an hour and a half. And I was in Chicago within a week with a friend of mine who also has very severe PTSD from things that have happened in his life. And we both got the treatment. And okay, the whole care was incredible. First of all, you get an intake call, a little bit like you would do if you'd have a psychedelic session. You get a certified licensed psychologist to speak with you, to explore with you what are you looking for, what has been going on with you, all of that. And then they decide whether you're fit for the procedure. So I went with my friend, and I can only speak for myself. I have to say, I got the first injection first, and I remember the first thing that happened, I started bawling. When I woke up, I just started crying, but it wasn't a cry there was no feeling with it, except, oh my God, I can just shed all this now. I don't have to hold all that. Suddenly the room looked like it had more color. Anyway, I don't remember the sequence of things. And then I had the second one, and the immediate, within 10 minutes, there was a distance between me and everything else. There was a healthy distance of, I could see the world as it was, rather than, how I was coloring it through my bad experiences, my own traumas, my own childhood stuff, my whatever. And I began to be able to be a little bit more objective, less activated, definitely less activated. Things that used to make me jump or upset me no longer do. And generally, by doing that, I have begun to see a lot of clients now that I referred to Dr. Lipov. The weirdest thing was the day before I went to America, I was talking to a colleague of mine who said, she said, hey, how are you doing and all that? I said, I'm going to America tomorrow. And he said, oh, I've been a little bit down, but I'm so much better now. I said, well, what did you do? Are you on antidepressants? He said, oh, are you crazy? I went and had this procedure called the stellate ganglion block. I said, you what? I said, that's why I'm going to the US tomorrow. He said, so he works with servicemen, you call them? Yeah, he works with a lot of first responders. And he said, I send all my first responders and their lives get completely changed. And then he said, we can do therapy, because that's the beauty of it, that then it's like this switch turns off that keeps you activated all the time, and you can actually begin to do the real work, and there's progress.
Right.
So for me, as a psychedelic therapist, I would definitely do this first and then go and do all of the other stuff. I think it could be a miraculous protocol for people.
Yeah. Well, Laura, I'm gonna have you reset your computer.
I will.
But we got all of that. But we'll hang out and chat for a little
Yeah.
bit while you do
Okay.
that.
I'll come back.
But yeah, so Dr. Lipov, like when I hear Laura say that, I think about this concept of let's sort out the physiological stuff first. To your
Sure.
point, let's sort out the
For
injury, and then perhaps we can add in other interventions after that, because when you're injured, perhaps the interventions aren't going to work all that great. Is that how would you see that?
So, well, we could talk about psychedelics as a separate environment.
Mm-hmm.
So let's talk about conventionals, right? So let me tell you a
Sure.
real story of a real person. So
Please.
this guy's job was to pick up dead bodies, his term, not mine, in Australia. So he was a policeman. He took up, he was depressed and he was doing very badly. Got divorced. He was suicidal. So his psychiatrist was also his therapist. So he tried everything he could for 5 years. No progress. So he had the stellate. 2 weeks later, marked improvement. So he was able to reduce his medication, and he was able to talk to the patient, the psychiatrist, and communicate with them without the guy shutting down or being upset, whatever. Because, and I'll explain to you why that happens. So what we find is after stellate, psychologists love to work with the patients because now they can get to the core of it and use rational mind to work through it. So let me give you a real example also, you'll understand it. So we had a patient, the first military person I treated was the second person I ever treated with stellate. So he was in line of duty, he was in Iraq, and a 10-year-old kid was sent to take out his quad. So my patient shoots him, and pieces of child hit him because there was an explosion. He comes home, the patient does, and he tries to strangle his wife a few times. So his wife said, either get fixed or go. So we do the block on him. His name is Jason Brown. There's a number of videos about him. Here's what he described 10 minutes later. He said, I remember going through what happened, but now it's black and white. The color is gone. The emotional hit is gone. I was going at 100 miles per hour. Now I'm going at 10 miles per hour. So what happens is there is two memories. Amygdala, which is emotional memory, and there is hippocampus, which remembers regular things. So stellate reduces amygdala function and improves hippocampal function. So that's why, if you think about it, so let's say there's some horrible rape or something horrible. When they start talking to a therapist, an amygdala will just shut you down because there's overwhelming amount of emotional upset. Here, when you are doing, we can reduce the amygdala, you can actually talk about it. It's like, this happened, and you probably know this better than I do. Memories are fluid. You can remember things differently. So the whole thing, you can remember that horrible thing differently, and you can live with it. Like I've had my treatment, I had my psychological treatment. I saw my mother dead on the floor after she hung herself. Highly traumatic event. Does it upset me now? No. It's a memory that I honor her memory by doing what I do, but it doesn't have the emotional hit. The other study I want to tell you about, which is pretty amazing to me, it was done in Philadelphia. So there was a guy who was a psychologist. He was working in a unit that everybody had hippocampal infarct, so short-term memory loss. So he can meet the same person, 20 times a day, and it's a new person every time, right? Something like that. So he showed nasty movies, like very sad movies. 3 hours later, he said, how do you feel? Sad. Why? Not an idea. Next day, showed him happy movies. 3 hours later, how do you feel? Really happy. Why? Not a clue. The amygdala operates separately from hippocampus. So this is what we're working with. So now, if you don't mind, I'd like to step into your environment and kind of tell you my perspective on psychedelics. So I know a lot about ketamine, for example. Is that a true psychedelic? Yeah, you can argue about it back and forth, right? But the reason I know a lot about ketamine is because as an anesthesiologist, I've used it clinically for 40 years. John Crystal from Yale figured out how to use it for depression. So what we've done is a combined stellate with ketamine. I call it SOF method, special operated force method, because it helps regrow brain tissue clearly. But ketamine does some bad things. It activates fight and flight nerves, which can make it bad. And actually, it also activates BAX protein. BAX protein chews up hippocampus, which is also bad. Stellate reverses that. So when people talk about the bad trip, either with ketamine, ibogaine, psilocybin, I mean, those are the ones I know a decent amount about because I've looked at them. It usually is because people are revved up. I had a patient that came in, she was riding around, the children, and had ketamine, she had a terrible trip. If you're revved, it changes in your chemistry. So if you come in not relaxed, not calm for a ibogaine trip, you're probably going to get a pretty bad trip out of it. So the point, if you think about fight and flight nerves, you need to calm them down. It doesn't mean do a stellate before every ibogaine experience. I'm not saying that. And my point is, if you're not in the right place, do not put your brain through a powerful brain chemical. Those are powerful brain chemicals. I had psilocybin. I was flying, in a beautiful spaceships through beautiful geometric figures. It was all gold and happiness unicorns for 8 hours. No problem. Did it do anything? Yeah, I don't know. I was feeling good from my stellate anyway. But my point is, the fight and flight level, where are you before you undergo a psychedelic trip? And I'm curious to see Laura's experience with that, is really important. And then one of the things I'm gonna give you a little teaser. So ibogaine, if you look at what ibogaine does to sympathetic nervous system, it's nuanced, meaning you can make it up, you can make it down. You really don't know what you're gonna get. It's like, I don't know. But what I did, I found recently 3 patients that were treated after ibogaine experience. They had great experience as far as addiction, but they couldn't sleep at all. They had severe sleep dysfunction. And sleep dysfunction apparently is reported quite often as ibogaine, my understanding. So all 3 of those had stellates, and they were able to sleep well after that. And we can talk about why that is. Anyway, up to you, Laura. This is a perfect setup.
Yeah, no, I completely agree. I mean, going into a psychedelic journey of any kind when you're activated like that is a complete no-no.
It's a bad idea, right? Because
You know,
then it just accelerates what ibogaine does. I'm sorry, it opens you to an experience. It doesn't guarantee a good experience.
well, it
Right?
amplifies. They're amplifiers, right?
Right.
That's another name we call them. And amplifying your state when you are in a bad state is not really what
Yeah,
we
you don't
want.
want that. It's already bad. Don't make it
Also,
much worse.
also, it's not really what will offer you some healing. I mean,
Right.
the whole reason of doing this is to discover some goodness. People who come to this work have suffered terribly,
Right.
and we
Right.
want to show them that they're capable of not suffering. They can choose to stop this sort of, incessant rumination of how bad
Remuneration.
things are
Right.
and all that, and so my feeling is always that we have to bring people to a good place before they enter such an experience, because it's a door. Okay, you open the door and you can see a lot of horrible things and a lot of amazing, everything is in there, the horrors of this world, the big love of this world, the compassion, everything is there.
Right.
But you can guide people, bring them in a good place so that they can see what they need, which is the love and the compassion and the hope and all that, because that is what will arm them to go on in life, and to begin to heal, forgive themselves, their families, whatever has happened to them. So in my practice or in any other context I am in, I do not allow people to take psychedelics if they're in a crisis or if they're in a really bad mental state. And what I mean mental state is, really negative self-talk, all of that, because it'll get amplified and we can't really detangle from that place that easily.
Can I ask you a question about that? So, what
Yeah.
tools do you use to calm people down before a journey? Obviously, if they're bouncing off the walls, you're not going to do it. But if they come in, let's say, gray, do you do meditation, do you breathing, yoga? What do you do? What do you use?
So I use visualization. I use a lot of grounding, like wherever we are, I will show them around and really teach their brain and their heart that they will, wherever we're going, we're going to come back to this place that makes them feel safe. It's all about safety, you know. When you give a person
Right.
safety, um, they are, you know, the chances are that they're going to have a much better experience. But the biggest tool for me for calming people, bringing people into a place of having a good experience is something a lot of people don't like, which is time. You know, you cannot take somebody because they call you on Thursday and say, I want to have a session on Saturday with you. No, because usually when someone says that, they're in a crisis. And you do,
Right.
I mean, for me, it's a rule not to do any such journey in a crisis, not even ketamine, not even anything.
I
Um,
agree. I agree.
yeah, because
No,
from,
I
yeah,
like your description of the amplifier. I think that's really a very good description because if the door is half open, you don't want it to go into a very negative path. So that's an issue. That's exactly right. So that's what I've been reading about ibogaine. Psilocybin is a different kind of animal by itself, but it's interesting how the ibogaine and neural growth factor and all those things that I'm really interested in, how it all interacts. But I think you're 100% right. If somebody's in a crisis, it's not a tranquilizer, right? Like atypical antipsychotics are tranquilizers. You take that and you're on your back. This is not what it does.
no.
This is opens you, and sometimes you can go to a good place, and sometimes you can go to hell. That's
I
not
only have a
good.
Also,
mild disagreement here regarding ketamine, given the data around the substantial decrease in acute suicidality
mhm.
after administration of
No
ketamine.
argument.
Yeah,
No.
but only in that scenario, right? Like I don't know that there's another appropriate scenario.
So I mean, so let's talk about ketamine. Something I know something
Hmm.
about. So it has a lot of very interesting effects. One of them, it works on nerve pain. So it's amazing through an interesting mechanism. It's not a true psychedelic. It's not like LSD. It's not like psilocybin. It's not like ibogaine. It has been used for acute suicidality, no question about it. So here's an interesting piece of data. There was a study done by a smart guy or woman, I don't know. Anyway, so they had people who broke up. They had the emotional breakup, angst. They gave them Tylenol. Turns out the angst got better. So what does that mean, right? So
Yeah,
perception of pain,
Oh, wow.
emotional pain, and perception of physical pain is the same. So ketamine works on pain. So could we use intravenous ketamine for severe pain, injured nerves, and stuff like that? So I think that's how it works. But I think you can get a bad trip out of ketamine as well.
oh sure.
I ideally, I mean, then the question is, I mean, how do you decide on all of that? What choices do you have? I mean, it gets more esoteric. But you're right. Ketamine, it's every one of those things is different. Like ibogaine to me is an amazing drug for addiction, but
Hmm.
it can kill you, right? So my point is, never do ketamine in a cave, ibogaine in a cave. You need to monitor your heart. You need to give magnesium. Be responsible, and it's a good drug. But we got to be careful, right?
Right. Yeah,
Ketamine
I just
can jump your pressure way up.
Yeah.
So you got to be careful with that.
yeah.
Psilocybin is more benign, but whatever. Here we are.
Thankfully, not so many deaths in the recreational ketamine market for things like that, but we do see regular announcements of uh, stuff in ibogaine. Like I just published something yesterday on a recent death in ibogaine,
Yeah.
Oh,
um, calling for collaboration. Like, let's actually figure out how all these operators can start
mhm.
sharing data,
Yes.
because they
No
Yes.
need to.
argument.
Yeah, they really
You're
need to.
100% right. And keep in mind, Stanford is doing massive studies on Ibogaine
Yes.
for
Hmm.
TBI, for addiction. But my point is, we know what it's not like a weird, some unknown people just fall over and die. No, no, no. I mean, in 2 centuries ago, yeah, they just, they called people, okay, it was time for them to die. I mean, I just, we're a little more sophisticated now. The point is, we know Ibogaine will cause cardiac dysfunction in a certain number of people. It's preventable by giving magnesium intravenous and monitoring and treating the right thing. The point is, it is it is possible to control it and deal with it, right? So my point is, it needs, whoever is giving it needs to be a responsible citizen. I think that's a reasonable approach. And it's a whole thing about knowledge. You have to understand it. You don't have to close your eyes and it's like, it's kind of, no, it's, I don't know what it does to the brain necessarily. I understand a little bit, but I understand a lot what it does to the heart. And as long as it's possible to do it safely, I'm all for that. Right? You're not poisoning your brain. You're doing some really good things for addiction and TBI. It grows new brain tissue. It does beautiful things, but it does have a tendency of affecting the heart in a bad way. So do it safely is my point. That's all I'm saying.
Yeah.
I have a question to Dr. Lipov, because we've had this discussion before, but I think it would be good to talk about it here. Dr. Lipov is not a big fan of MDMA.
True.
I probably ate too much of it, but I slowed way down.
Fair enough. Well, I'll tell you my perspective. I've never used it, nor will I ever use it. Ibogaine, I would, but I would do it with a monitor on me, let me tell you, and somebody else watching it, not me. So MDMA is not a true psychedelic, so to speak. It's purely synthetic. It's not like, like ketamine is also purely synthetic. Just let's be real. So psilocybin, Ibogaine, God made it, right? We did not. Human beings didn't make it. But MDMA is basically amphetamine. It's a high-power amphetamine. It kicks out a lot of oxytocin. Oxytocin is a great, we love you drug. So keep in mind, it was clinically used in 1970s. MDMA was clinically used in psychiatric practice. And then it went to hell because people started abusing it and all type of stuff. I've met a number of people who had really good responses to MDMA. But in order to do it right, from what my reading, is you need to have 2 therapists, 8 hours a day, 2 days. I've met some of those therapists. Those guys look like they were rolled over by a tank. It's very intense work. And also, I'll just give you a, that's not really very scientific. I cannot point to saying like neurotoxicity. There seems to be some debate about it. But one thing it does do, we know, is produce high temperature in the body. So let me give you an example of what really happened in New York. Some wise guy had a bar, and he decided to give everybody Molly. No cost. Molly is the same as MDMA. It's like, okay, here's Molly. So the question is, how does he make money? Well, everybody got thirsty. So he would charge $100 a bottle of water. So people are drinking out of toilets because they're becoming hyperthermic. Hyperthermia will kill you. It'll burn down your muscles. It'll kill your kidneys, all of that. Is that irresponsible using Molly? Clearly not. But my problem with, in general, MDMA, it doesn't necessarily have a safe region, right? When somebody wants to get high and that's not high enough, then you go higher more, then you get higher more. Where do you end? Like, for example, what's starting to happen with THC, which is another story altogether, I've met a lady whose girlfriend was taking high-level THC gummies. No problem. She gave it to her girlfriend, one high dose, and she got tardive dyskinesia. She became suicidal. She's probably dead by now. One dose. So my point is, you have to be careful with certain substances, certain doses, and how much do you take. But again, MDMA, I'm not a fan. I'll just be upfront.
Yeah, this is part of what we're doing, is educating people. I think there's a lot of complications with the legal compounds too that people can buy at the store. So like, how do we actually develop an intelligent drug culture, where people can actually be more appropriate and more skillful? Apparently with all this stuff coming out in the news today, we as a culture still have to learn a lot about consent. So that goes into it also.
You mean somebody's Giving somebody a drug that they don't consent to? Is that what you mean?
Oh, yeah, generally, but beyond that too. I was kind of making a obtuse reference to Epstein and Diddy.
Oh,
But
Yeah,
you know,
right.
whoa.
yeah,
I mean, honestly, that you cannot blame the drug that was used. The operator was the
yeah,
problem.
No, exactly.
yeah.
The operator was the problem.
Yet another
That's not the
weapon,
drug. Yeah.
But
I
drug
mean,
as weapon.
talking about
But my
MDMA,
point is that we need to
yeah.
do better with consent, because
yes.
your story about the bar, like that's it's not exactly uncommon. There's a lot of bars and music venues that don't allow people to get free water from a water fountain even. And that's it. It really should be criminal, because people will get hurt,
That's
MDMA
my
or no
point.
MDMA. But it will
Yeah,
happen.
just dehydration.
Mhm.
Being out there, 110-degree
Mhm.
heat, you shouldn't have to pay $1,000 to stay hydrated. That's just wrong. And you
No.
cannot bring your own water. That's wrong.
Right.
Like Burning
Yeah.
Man would never do something like that, right? They would never do that.
No.
What, to stop you from getting water?
Yes, because you bring your own supplies. They'll let you bring stuff in Burning Man.
Yeah.
And they do a whole thing. From what I've never been, but I understand, you can bring your own trailer, you can bring your food, you can bring your water. You don't want to kill somebody who are enjoying themselves.
No.
That's just wrong.
There's very, very few deaths from dehydration there. It's more other things.
And therapeutically, I mean, the reason I brought MDMA, me and
Yeah.
my, the reason I brought MDMA, because, it's got so much research has been done, and it was close to being legalized for trauma, for PTSD and all that. I mean, if you think about it, its mechanism is very similar to the stellate ganglion block.
No, it's opposite. It's opposite.
Well, no, because
it's think about what it is. It's speed. Speed kicks out norepinephrine. It's overwhelming amount of speed.
But apparently, it turns off your amygdala for a few hours, so that you can go through.
So does a hammer.
Hold on. What I'm trying to say is that you don't need to take MDMA for a few hours. You can, if you do the ganglion block, then you have a much calmer amygdala forever, if you're lucky.
So sorry, Lara. I could resist.
It's okay. I know you well enough now. So do your thing. But what I'm trying to say is that if people don't want to do MDMA and don't believe in it, or it's legally not available, there are also other ways, such as this, that do a very similar job. If you, with the procedure, your amygdala begins to kind of calm, then all the therapeutic work can occur. So in
100%.
a way,
I agree with that.
Very similar thing.
The other thing, I would like to add, if you don't mind, is that what does psilocybin and ibogaine, for example, what do they do to the amygdala? That's a great question, right? So there are a couple of ways to control the amygdala. One is you can reduce the sympathetic tone. That's what it does. Frankly, I really don't know the MDMA literature. I don't know the literature. But psilocybin, for example, makes nerves grow, no question. It produces BNGF. And what it does, it increases the function of prefrontal cortex, PFC, and hippocampus. That's why a lot of people, the memory improves, all of that stuff happens. Ibogaine also works on TBI, traumatic brain injury, by growing new nerve tissue. So it turns out there are two parts of the brain that are designed to suppress the amygdala. They are PFC, prefrontal cortex, and hippocampus. Those are two. The stronger those guys are, the less anxious you are. So one of the things that I gave presentation at American Psychiatric Association is using Tetris video game, just playing the video game, nothing special, to treat PTSD. Why does that work? It increases the function of hippocampus and suppresses the amygdala. Isn't that interesting? So the whole thing is you're getting your brain stronger. So if you can meditate, take psilocybin, for example, take a beautiful journey, it calms you down. It really is very effective for depression. Not as much for PTSD based on my reading. But the point is, as you're getting the brain tissue together and making it stronger, you're not as anxious. That's the whole thing. So you can either raise the bridge or lower the water. Stellate lowers the water, while psilocybin and ibogaine raise the bridge.
I find Tetris incredibly stressful, but I think
Okay, then don't do that.
I'll try it. I'll try it. We'll see.
design another game for you, Joe.
I
But
maybe
it's I love
less,
it, though.
smaller blocks. Smaller
Yeah,
blocks.
please, smaller blocks. Yeah, absolutely. No, but it's fascinating. I wonder what the mechanism is around that. And
Of what?
so,
Tetris? I can tell you
right,
the answer for Tetris.
please.
So it's been studied. I mean, the reason I even got into that because I had a TV station from San Francisco said, "Why does Tetris work for PTSD?" I was like, "What? What are you talking about?" So, in order to manipulate things in your brain, like how do you move the blocks around? It activates brain function to do that, right? Hippocampus is part of that. So they did functional MRI before and after, and they saw overactivation of hippocampus. So we know hippocampus suppresses the amygdala. But in order to process three-dimensional predictive models, hippocampus is part of it. That's how it works.
Great.
I mean, I'm not enough a neuroscientist to give you more detail, but I think the whole thing that you can actually measure that. I'm big into measurement, right? Saying take my word for it is just stupid, in my opinion, in 2026. But you can actually measure it. You can actually see a change. Well, that's a big deal.
So I want to jump back into where we started, Dr. Lipov, around reframing the name PTSI
Sure.
from PTSD. And just so it's clear that this intervention, stellar ganglion blocks, give room for a sort of physical healing or a regulation without other psychiatric interventions, like without therapy. We can see like an actual kind of organic structural shift towards a healthier state.
Is that a question you're telling me?
That's more of a question. Yeah.
So let me tell you what we know. I mean,
Great.
I've been in academics long enough. If I make a comment in medicine, I like to be able to give you a reference. So
Thank you.
Dr. Alkire published a paper in 2015. It's on my website. If people are interested, at dreugenelipov.com. If you want any of the references, you can pull them up and read them. The actual papers. Anyway, what he did is he took the sickest people with PTSD in the Long Beach VA. He did a PET scan. So PET scan is basically a glucose that's tagged with isotope. So the brain chews up glucose specifically, right? So the more glucose you chew up, the more active the part of the brain is. Simple. So he did a PET scan before stellate and after stellate with people with severe PTSD. So what they found is that after stellate, the amygdala was deactivated, so the function was reduced, and they had a concomitant reduction of symptoms. So it makes perfect sense, right? So you actually, that has been measured. So the study being in NYU, right now they're doing the same thing using fMR, which is functional MRI. They're chasing water around. So the more water is being used by amygdala, the more signal. So it's not out yet. It'll be about 6 months. But that's going to be the only real study done by a real big institution, by real people saying this is what happened. Because part of the concern of stellate has been, well, you can't do a placebo, your placebo is bad, blah, 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 because it's not a drug. You cannot take a sugar pill. Because every time you do a block, the eye droops and it's red. So you know who had the block, who didn't, right? So you can't really fool people. That's why we always needed the fMR or a PET scan to demonstrate it. Unfortunately, it's almost out.
Where is the injection? Yeah, absolutely.
So right here.
Okay.
So, well, stellate, original stellate ganglion block that's been done since 1925. My father was born in 1925, so it's been a while. So it's here. Then I found when you do 2 levels, so there are 3 ganglia or 3 nexus to fight and flight system to the brain, here and here. So we do 2 levels. So I call it DSR, dual sympathetic reset. So it's 2 levels, but it's right here. So if you'd like, I'll describe to you the procedure because a lot of times you've probably never heard of it. So people come in, we do consent, the usual stuff. They lie down. I use ultrasound guidance to see where I'm going. ultrasound will tell me where the blood vessels are. There's a lot of blood vessels, nerves, and other structures. So if I know where I'm going, it's much safer, obviously, right? So we numb up the skin, little lidocaine, just like a dentist. Hurts much less than a dentist because there's many more nerves in the mouth. So half of our patients like to go to sleep, the other one don't. It doesn't really matter. And then we put the needle under ultrasound, inject the medicine here so I can see it. If you go on YouTube, put in my name, you'll see my blog being done for me. You can actually see other people being done. There's a lot of coverage on that. So it takes about, in experienced hands, 5 minutes for everything. And the results, a lot of times, is seen in the first 5 to 10 minutes. Because norepinephrine level drops, right? We're not waiting for a lot of different things. Now, does everybody I do a procedure on do psychological interventions? No. We try to do it, but not everybody wants to do it. They're not interested. They don't want to talk about their problems. Whatever the reason, right? A lot of time, physiologically, it will give you a significant reset, and they may not need anything. But ideally, what we want to do afterwards is psychological intervention. So you can actually get your mind around it. You can process it. 1. 2, meditation is great because meditation grows nerve tissue. And guess what it grows in nerve tissue? Prefrontal cortex. So it can suppress the amygdala. So all of that, because a lot of people, before we do the block, they're so wigged out, they cannot meditate. They're like 2 minutes later, they're crawling out of their skin, right? While here, it's like, oh, okay, I'm cool. It's all good. Nothing to see here. I'm cool. So that's where we're at.
It's
So
fascinating.
can I ask something, Dr. Lipov? I'm interested in your, I mean, we've discussed this before.
I'm here for you.
I know. You've been amazing. The efficacy rates are quite high,
Yes.
but they're not 100%.
No.
Yeah.
100%? No.
But they're not 100%.
All right.
So
80 to 85% is our success rate.
So what do you notice? Who is not getting it?
You're asking who will fail or what do you do with failures? I think it's one of the other questions you're asking.
Let's also get the metric in there too. So like what is success and what is failure?
Fair enough. I like your question. You're a born scientist. There you go. So the metric, as you say, the standard assessment tool that's used by most people in the space is called PCL, PTSD checklist. Do I like PCL? No, I do not. But that's what everybody uses. So if you don't have it, you can't publish on it. So I like to publish. So anyway, so definition of success is 10-unit reduction or more.
Mm-hmm.
So the maximum amount PCL is basically goes from 21 to 85. So 10-unit drop is considered therapeutic. Our average unit drop is 26, which is significant, right? There are other things we could talk about. How do you define metrics? Blah, blah, blah. I'm not going to bore you with that. But then, so that's how we define it. And, certain people, they come in, they only have 1 or 2 symptoms. Like they can't sleep. That's only 5 points. I mean, and if the 5 point is drop and they can now sleep, PCL doesn't really reflect that. My point is it's not a great tool, but that's the only tool we got. So then the question is, so let's say we do the right side and nothing happens. Keep in mind, for the first 8 years, I only did the right side. I didn't know about the left side. So another clinician came up with the idea of left side. We do right and left. That seems to work well. So there is a little caveat there. So if you do right side, sometimes people can get hoarse from that because for about 8 hours. That's because the recurrent laryngeal nerve knocks out one of the vocal cords. If you go to the other side immediately and do the other one, so both vocal cords will go to the midline, and that's a massive problem. So if anybody offers you or your listeners, oh yeah, we'll do the right side and left side, like bang, 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 run. Don't even ask questions. Run the other way quick. So occasionally we do both sides the same day. We try to do it alternative days, but if you do it the same day, we take a 2-hour interval. I want to make sure people can swallow, they can breathe right. There are specific things. But the point is, what we're finding is that when you do both the same day, there seems to be more efficacious for people who fail. Your question is, what is the failure rate? I mean, and why do people fail? I spend a lot of time thinking about it. The other part is I've run into this amazing man who developed an assay to figure out dopamine receptor immune dysfunction. So that could be an infection that's actually causing that. You need to treat the infection, or heavy metal poisoning can look like PTSD. The point is there are other things. I'm not in a teaching institution enough to be able to look at the failures and say they failed because of this. So it could be infections, toxoplasmosis, or some kind of parasite, something weird that's causing it. They could be a parasite inside the brain. I don't know. They could be acting weird, right? So the point is, you would need to get very esoteric. But the way I look at the word, just so you know now, is all psychiatric conditions are divided in two conditions: sympathetically mediated and not. Why do I say that? 2002, there was a patient that was a schizophrenic who was riding a horse in Japan. It's like esoteric. He gets kicked off the horse, fractures his shoulder. They do stellate, take away shoulder pain. His voices went away. It's like, what? Why would that happen? Because fight and flight nerves have a lot to do with schizophrenia. Psychiatrists have not woken up to that fact yet. They're still snoozing on that. I also took care of a patient that had something called functional seizures. Functional seizures, when I was in medical school in 1984, basically you're lying. There's no seizure. Go away. Don't bother us. You're lying. Goodbye now. And the definition of that is you have a seizure, so-called, and they get an EEG on them, and it looks normal. They go, well, go away. You're lying, right? Well, I had a patient like that. Let me tell you the story. So she was doing fine. 3 years prior to our treatment, she started having those seizures. Went to the hospital. You're lying. Go away. What should I be doing? Wear a helmet. This is a 28-year-old female. What do you mean wear a helmet? Well, it turns out if you use functional MRI, you can actually see the seizures. Again, you need to have better diagnostics. We did the blocks. No seizures in the last year. Nothing. The point is, there is all type of things which are functional condition. Functional means we cannot explain it, thus the patient is lying. Before, like I always, when I train my residents and fellows, like before you accuse somebody of lying, really know what you're talking about, right? When somebody has pain and you haven't done the right scans, like I've had people who are accused of they're lying about pain, narcotic seeking. I did the MRI and I had a big tumor in the pelvis. Well, I don't think they were lying. My point is, before you accuse the fingers, be very careful with that. Anyway, that's kind of, I'm getting off my soapbox now.
Oh man, so I think that's fascinating. Yeah, in my world we call them like kind of structural organic induced kind of psychiatric conditions.
Yeah.
And they're somewhat rare, but what you're indicating is that there's potentially a lot more of them than we understand.
Well, let me give you another example. I mean, you know, you're old when you have examples about everything. So we had a patient that she was raped and abused before she was 5, right? Severe trauma. So when she presented to our clinics, she had psychotic breakdowns once a month. She had 16 personality disorders. The dominant one was a monster. That's what she called her, because she was such a nasty, and she had PTSD. So she had 3 diagnosed when she arrived on our doorstep: psychosis, multiple personality disorder, DID, and PTSD. Right? Stellate. For a year, no psychotic breakdowns. So she had 3 stellates in 3 years. Today, I mean, it's something that we're going to be publishing relatively soon. She went from 16 personalities to 3. So the collapse of personalities. And then dominant personality now is matriarch, very calm, polite, pleasant. 0 admission to psychiatric for psychotic breakdowns. So after I looked at that, it's very interesting. Pediatric trauma is very common in producing multiple personality disorders. Right? So the question is, why does that happen? That's what's interesting. Why do people fracture the personalities? And it's like people go, well, multiple personality disorders don't exist. They're lying. They're functional, right? I hate that term, functional. It's just because we are stupid as physicians. We don't understand it. Okay, well, you're stupid because you're having that. They have complications, right? I mean, you could actually. I had one patient that was like I used to take care of. She had 8 personalities. You could see very distinct personalities. Oh, Martha is here. I didn't do it. That was her. That was me. It's like, okay, crazy. Anyway, so they fracture because if somebody is being abused, let's say raped continuously, they have to escape to a different reality. So the personality being raped is one, but the core personality is trying to save itself. That's why they get fractured. That's all published, right? I mean, Laura, this is more your space than mine.
No, totally. That's exactly it.
But the part of personality that keeps them split after they're safe, they cannot get safety. It's a fight and flight. So if you calm, the sympathetic system goes, okay, nothing to see here. I don't need 13 personalities. Now we have 3, and now I'm good. 3 is much better to manage than 16. That interesting? It's weird. So when people use functional, I was like, don't accuse people of stuff before you really looked into it. I think you may not know everything. I mean, I know you think you know everything. Why you have an MD? Woo, be hee hee.
Yeah, that's fascinating in that like the complexity just kind of collapses into a simpler structure. And
Well, it seems the sympathetic nervous system is responsible for so much. So much, psychiatric conditions and our everyday life, and everything. And I'm surprised that the psychiatric community hasn't really cottoned into this. It should be the first call.
Well, I presented to American Psychiatry 4 times. I just want to throw one more thing in. Here's what's interesting. The immune system is controlled by fight and flight. So stellate ganglion block is connected to thymus, which controls T cells, and bone marrow controls B cells, right? So if you look at people who have autoimmune disorders associated with schizophrenia, so interleukin-6 is produced in the body. It goes inside the brain. Once it's increased there, it produces depression and psychiatric conditions. Stellate resets that to a better function. So I agree with you. I think that is all going to change. All of that will be changing in the next 10 years. And I'll be hopefully one of those people pushing that cart along.
Please, because also, there's the epigenetic component here. You get your parents with all this trauma and all this sympathetic arousal. I mean, I remember my mother till the day she died, she thought the Nazis were after her, and she'd been in America for 40 years and all that. And I was like, oh my God, and that gets transmitted to your children, to your grandchildren, and
it also makes you age faster. The point is, all of that is reversible. That's what's interesting. So I wrote a paper with special forces. After stellate, they were able to get 2.5 years of aging reversed after stellate. Because the aging is associated, because if you think about it, sympathetic system, let's say you have a car, right? So if you're running a car at 2,000 RPMs as opposed to 5,000 RPMs, your engine is going to wear out faster when you do 5,000 RPMs. So sympathetic system is always revving you. So if you can calm it down, you're going to live longer.
Yeah.
Simple. Right? I mean, it sounds like people make it like, whoa, this is really complicated, multiple systems. No. 3 systems: sympathetic, immune, and genetics or epigenetics. That's it. Simple. If you could look at that from that perspective, you can really understand a much clearer picture of what's going on. And why can't you pass it down 2 generations? It is. And if you think about it, it's all adaptive. If you're a caveman and you have a saber-toothed tiger next to you, you want your kids to be hyper vigilant so you don't get eaten, right? So there is a reason why bodies can do all of that. But when it also affects fertility, it affects a lot of things. But if you can calm the body down, then it can function in a more normal way, longer, with less misery. and then you don't pass it down to your loved ones, which is like the
The
worst
whole
thing.
world is affected. Our governments are
Yeah,
affected. Our military, everything we do.
yeah,
You know,
yeah. True.
the systems we live in are all affected by trauma. You know, they're all a response to intergenerational trauma. If you think about 3-4 generations ago, what was going on in the world, we are all, you know, the result of all this. You know, what happens if that can be halted now?
I
And
agree.
you know, because
Well,
we're not only suffering from that, we're also perpetuating more and more of it. And you know, um, there's no need for
yeah,
me
I
to
know.
explain
Well,
to you
we
the
can change the
repercussions.
world. I think we can change each individual one at a time.
Yeah.
So to that, actually, I need to do shameless plug for my new book. It's called The God Shot, and the reason I love the title. Let me tell you where the title came from. I took care of a Marine, and he said, "Oh yeah, I'm here to get the gut shot." I was like,
I
"Wait,
have it.
oh yay, woo, Lara!" Anyway, the reason I called that because it changes lives. The only entity that can change lives is God, and that's why they call the God shot, because it changed people's lives. So, and it was written by an amazing writer, not me. I just gave the content, but Lauren is an amazing writer. The point, though, is it's possible to change your life in a better direction. You cannot control what's done to you, but what you can control is how you respond to it, right? So, horrible stuff is happening, will continue to happen. But if you can stay calm through it, you're more likely to survive. And just to remember, you can pass that down 2, 3 generations. I can even tell you which part of the DNA has changed. If you can reverse it, if you stop the trauma, if you dial it back, sympathetic system, that goes back to normal, which is amazing. There have been studies showing, not just stellate, like psychiatric intervention, psychological intervention that has cured depression. They were able to show DNA reversal to normal.
Mhm.
Isn't that amazing? I think
Yeah,
all that's just amazing. And it's biology. It's not hypothetical. It's not we're just pretending. It's biology. That's the key.
Can you speak to what you think the results might be in a sort of placebo controlled fashion? Like if we were like, and what would a if you've been at this for a while, what would a good placebo be?
Human from stellate?
Yes.
It's not possible. I've
Mhm.
had this discussion forever. So for example,
Yeah.
I was talking, here's what happens, just so you understand why it's not possible. When you do a stellate, your eye, when you've hit the right target, your eye becomes red, the eye closes, and you can't breathe through the nose. So when I was talking to Hopkins, I go, "Why, we can do a placebo, let's put a patch on." I said, "How is that going to work? That's stupid." And your arm gets hot. You can tell the difference. It's impossible. The whole concept of placebo does not apply to stellate.
Mhm.
It applies to drugs because you can do a sugar pill, you can't tell the difference. Here, you can clearly tell the difference. That's why the only study that should be done is doing fMR, PET scans. Look at the final thing. So let me ask you this question: how do you do a placebo? If someone has a broken leg or not? Can you do a placebo test? No, no, it's impossible, right? I mean, you
That's
see the
great.
bruising, you have a
Yeah.
bone sticking out. Oh, you don't have a bone sticking out? Okay. If you got people who have Down syndrome, maybe you could convince them, but it's impossible. There's no such thing. Placebo is bullshit when it comes to stellate. And
Yeah.
equally, if you think about it in psychedelic literature, look at the placebo there.
It's very difficult. Very
You can't.
difficult. It's
You
not the
can't.
same comparison, but it's close. It's really
Close.
close.
I know it's not the
Yeah.
same, but it's like
Um,
I've read about it. It's like kind of, maybe, sorta. I don't know.
yeah.
Yeah, I don't know.
A guy I admire on the internet. What is his name? Vinay Gupta. He developed a lot of kind of emergency kind of preparedness stuff. I think he works for FEMA sometimes. But he and I had a really interesting conversation about kind of wasting money by using placebo generally, and like could
Yeah.
we do com- different treatments? Like for we were talking about meditation And so how do we actually not just do placebo meditation? Because it's
Well,
also
I can tell
kind
you
of
how to do
goofy.
it. It's easy. The study design. You talk about study design. I spend a lot of time thinking about it.
Yeah,
The easiest
please.
way to do is called waitlist placebo. So you have 30 days you wait in one group, the other one gets treatment. You evaluate them in 30 days. Instill it, something like it has been done. PCL is stable, no intervention. PCL is down, intervention, right?
Mm,
Or the alternatively, you have dual forks, like you wait for them, like whatever, 30 days,
mhm,
and then you can cross over, you can do all that. But wait list placebo is the best way to do it. The same thing, meditation. You can do meditation. Let's say you do meditation for 3 months in this group, another one just hangs around, does whatever. You do a brain scan. Meditation will show you thickening of prefrontal cortex. Other one will
mm,
not. What do you need
mm.
placebo for? What is that?
Mhm.
Yeah. In our conversation, we were comparing the performance of different techniques. And I think there's something there with
Oh,
psychedelics too,
meditation.
perhaps.
Okay, I
Right.
don't know.
In meditation so like how do we actually kind of just put, 5 up? And perhaps that's better than like better performance per dollar than a placebo controlled trial.
Oh, 100%.
Yeah.
I think the whole concept of placebo has been taking, and I mean, I've argued with people like you would not believe at high institutions about that. The whole concept of placebo was okay in certain environments.
Hmm.
When you have a sugar pill against antidepressant, okay, I can live with that because you cannot tell the difference. But when you can tell the difference, when somebody's meditating, they know they're meditating. But you
Hmm.
can actually tell the meditation if you do fMR or EMG or EEG, you can do certain testing, see if they're in meditative state. If somebody tells you they're meditating, they may not be meditating. So how do you deal with that particular issue?
I guess that's a scale function, statistics, and hope they're not
Well, that's
lying.
why it doesn't matter. My point is, I don't
Right.
care when people like, I don't care if people tell me. For example, when they come to see me, I have
Yeah.
PTSD. You think I ask him what kind of trauma they had? I don't care. Needles go to the same spot. I don't care. It doesn't matter. Let me fix
Hmm.
his symptoms. What are the symptoms I have to get rid of? I can't sleep. I'm hypervigilant. I can't have sex. Whatever. We do the block. Poof, the symptoms go away. That's all I care about. Everything else, blah 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 blah. I feel so much better. I don't know what that means. Symptoms are gone. You can sleep. You check your order ring, right? Your order
Yeah.
shows that you're sleeping. What a concept! Look at this. You can actually check the HRV and sleep depth using that. So we've had people who had, sorry about that. We had a number of people who had order ring significant changes following the stellate. Now that I can get behind. I get that. They need to have placebo, no placebo. Did you have the right thing? Did you hit the ganglion? Did you use the same volume? What does that even mean? I don't
Hmm.
know what that means, and nobody else does. Let me assure you.
So working towards wrapping up here,
Sure.
I'm curious. And everybody should check out your charity, Erase PTSD Now. You can
Please.
help support moving this towards PTSI and help people. So please,
itsptsi.com is the website.
it's ptsi.com. Yeah.
So
So
if you want to
we'll
have
have it in the
treatment,
show notes.
last shameless plug.
Please.
So I'm a CMO, Chief Medical Officer for Stella Mental Health. We have sites and 24 sites in United States, 1 in Israel, and 4 in Australia. So if you want actual treatment, talk to the people. You're talking about is a great thing. I am an invasivist, meaning I'd rather do less talking, more sticking.
Thank you. Thank you for
I'll
that.
stick.
Anytime.
So the question is, just you've studied some of these psychedelic compounds. Like, how, from your perspective, how could psychedelic research kind of improve a little bit from what you know of the 3 drugs: ibogaine, psilocybin, MDMA?
Well, MDMA, if you don't mind, we'll put it on the side. You should ask somebody
Please.
who actually cares about that drug. I don't. So
Yep.
I know I'm brutal, but whatever. I think psilocybin is an amazing drug. It's the safest thing out there, and it works well for depression. So I think people should. A lot of this stuff is really not medicine; it's politics. So if you look what happened with Leary and LSD, the whole thing went nuts. I think that's so if that can be figured out, I think there is a taste for that, and it's starting to become easy to get. You can get access to psilocybin without much of a problem in a lot of parts of the union currently. So I mean, to me, if I was going to do, I mean, it depends what you have. So if somebody have, so I'll just break it down. How do you actually apply it? It depends what you're trying to do. If you're trying to commune with God or another level, I am not the guy for you. There are plenty of people much smarter than me in that space. Clinically, if you want to get better, let's say you have depression, I would start psilocybin. It's a benign drug. There's very few physical, like it's not going to stop your heart. It's not going to cook your liver. It's not going to do anything to your brain. That's bad. You can have a bad trip, so you have to be prepared for that. But short of that, I would say, from my perspective, it's the safest drug out there. If you have addictions, Ibogaine is your friend. It has been shown to be very effective for addiction. It's been shown in some of our toughest warriors to help with PTSD and TBI. So Ibogaine is great. However, make sure your heart is stable. Make sure you don't do it in a cave. There is a place in Cancun. I'm not going to bring up the name. That's seem to be everybody is going there currently. But from what I understand, they do it the right way. They monitor the heart. They give magnesium, and that place is not going to have any death. There will be occasional death reports and Ibogaine when people do it irresponsibly. It's that simple. So I mean that's how I look at it. PTSD, I think. I mean, I personally think people should have stellates because of all the drugs out there. The cool thing about stellate, it's been around since 1925. The local anesthetic that we use is used on pregnant women, so it's bupivacaine. If you can calm down the system, that may be all it takes. Now, if you don't like the whole idea, it depends, what you want to do and the whole environment. I mean, that's personal choices. But I mean, that's how I make that decision, right? And like equally, I had somebody call me out of the blue and he says, all right, I have this, I have addiction, I have this, I have PTSD. What should I do? Somebody said I should try stellate. I said, no, I don't think you should start it. Why don't you get Ibogaine? He went, he got Ibogaine, came back. My addictions are gone. I can't sleep. I did the block. Poof, he can sleep. So it's a symptomatic thing. I mean, there's no, I go where people are interested in. I mean, can you start with, could that guy work? Could have responded stellate? Could have. We've had a number of people. Last thing I'd like to get on a soapbox about addiction. People talk about alcohol abuse disorder. Hate that term because it implies it's a separate condition. It's a symptom. You're trying to take the troubles for a swim and you cannot drown them, right? It comes back. So we took care of a Lieutenant SEAL guy, tough guy, a liter a day of alcohol for 10 years. You think he'd be dead, but he was still alive. We did the stellate, PTSD gone, stopped drinking cold turkey, no withdrawals, no nothing. He did great. So the point is, addiction is a symptom underlying problem, overactive amygdala or sympathetic system. So that's why if you can fix underlying problem, addictions melt away. You don't need all this complicated thing, because if you talk to somebody who's an AA, 50 years later, they have all their coins. I got all of this. They had the whole thing. If I put a drink in front of you, it's still calling you. Yes, I have to work very hard not to drink it. Well, that's no good. It needs to I don't care about this drink, garbage. Go away, drink. That's what I'm talking about. That's where you want to get to. And it's possible. That's the thing. It's possible. So I'm
One of
also
the things,
box again.
last thing I want to bring up here, as a, somebody who really has to kind of open the way for some people, because there are people that come to me and say, I'm feeling this, I'm feeling that, blah, blah, blah. Where do I start? How do I do this? Should I do MDMA? Should I do psychedelic ABC, whatever? Should I go and do EMDR? Should I hit the gym? Should I stop drinking? There's all this stuff. Anyway, so the thing, I mean, of course, I love this book that Dr. Lipov has written. It's very informative, but one chapter really I love is the roadmap to healing and recovery. And when I opened it, I thought, oh, this is going to be really basic. He's just a doctor, you know, and he likes needles.
Well, nothing.
But actually, it's very, very good because, you know, it scaffolds the whole process in a very profound way. For example, it tells you, you know, check your keys first, your sleep, your nutrition, movement, mindfulness, your hormones, your thyroid, your heavy metals, and your toxins. Nobody talks about that. If you have all these things, all these things are out of whack, of course, you're even going to have PTSD. Mold causes brain function issues. It causes PTSD. Now they say that if you have had mold for a long time, it causes PTSD in the brain. Most people don't have a clue that this happens.
Low T, low testosterone will give you depression.
Right. So this is a very good roadmap. It's very well written. Thank you for doing that, because there aren't many. There's too much complexity out there for people who want to get well quickly. So this is good. So
thank you, Laura.
Mm-hmm.
All right. Well, thank you both so much for being here today. I'll line up for a jab at some point. Can't wait. And
I was going to ask you, when are you going?
Maybe later.
My guy's out of town.
Okay.
So we'll figure it out. Yeah.
Well, you can always call me.
Both.
We can talk about if you. But by the way, this is just so you know, as an invasivist, I am a responsible invasivist. Meaning, when somebody comes in and just do a job, it's like, why not? It's like, what are you trying to treat? Understand what you're trying to get better, right? We're not just doing it just willy-nilly, right? So people will evaluate you. It's a physical procedure. We're piercing the skin. Anybody who just takes it willy-nilly, it's not. Mm-hmm. Be respectful of it, is my only point.
Yeah, thank you. Appreciate that. And all right, well, thank you both. Let's hang out backstage for a minute to let this upload. But thank you, everybody, for tuning in. And this will be live on the podcast in the near term. Take care.
Thank you.